Hey, Emilee. Welcome to the Birth Story podcast. Can you hear me?
I can, yes.
Okay, awesome. There's some amazing background music.
Yeah.
And I'm not sure how to make that stop playing music. Welcome to episode 1 on Fireside. Let me see. Let's see. Mute their microphone.
Oh,
I think that was the wait bot.
yeah.
Okay, good. I was like, man, I don't know if I'm going to be able to deal with that music while we're talking this whole time. So how are you doing today? Are you going to come on video?
I can. I'm trying to figure out how I do that.
It's all new. So I clicked on my little bot and then it just had a little thing that said, come on video. I might be able to click on your name and ask you to invite to video mode. I just invited you.
Okay.
I'm so excited for today's episode with you, Em.
I'm excited too.
Thank you so much for being here and joining on Fireside. And this will also broadcast out to the entire Birth Story podcast population. So a few things that I'm learning, I let them know. So, and Em, I think you follow me on social. So all of my audience knows I am 6 days post-op from my mommy makeover. I would like to give myself a round of applause. But this is the first time in my support compression bra that I have been sitting up in a chair day 6 post-surgery. So this is just the disclaimer. If anyone jumps on to watch this video, and most everyone will just be listening, I'm sure. But if you are watching this live, Emilee, welcome to my closet and my beautiful ensuite bathroom and the nightgown and chest compression that I've been in for 6 days while I wait to see the plastic surgeon tomorrow. So anyway, maybe there's virtual backgrounds on here that I'm unaware of, but
that's true.
I would love that. Hey, Mark Cuban, if you could add a virtual background for those of us that like to go to the plastic surgeon's office every now and then, I'm like, that would be great. Here we are. So, thank you so much for joining the Birth Story podcast. And I keep calling you Em because that's your name on social. So do you prefer that I say Emilee or that I just say Em?
Em is perfect.
Okay. Hey, Em. Now, I am excited to dig into your birth story and to talk about birth center birthing and also male infertility. So this is a hot topic and not one that we talk about enough. The narrative that we hear as women and as birthing persons is it's our body of why we're not conceiving.
Yeah.
And
even just from when you join fertility groups or on Instagram, finding people who are doing IVF, it's usually the woman's problem. So I've had a hard time finding other women who are coming from my perspective as well.
Yeah. Well, let's dig into it because I want to dispel that myth today and I want to talk about male infertility. And then I also want to talk about our options of birthing in a birth center. So, sound good? Can you start me at the beginning, Em?
Sure.
So, tell us who you are. How old is your child whose birth we're going to be talking about today? How did you meet your partner? All the things. Just let our audience know about you.
Yeah. So me and my husband, we met, probably about 6 or 7 years ago. We've been married for 2 years. We were friends for a very long time before we finally decided to start dating. So we got married 2 years ago. We knew from the very beginning that we would have to do IVF. So we basically, as soon as we got married, we started the process of getting a referral and finding out information on that, and started right away with seeing doctors and doing the tests and doing all things. And then my daughter, whose name is McAllister, she is 10 months old.
McAllister, 10 months. Yeah. I love the name McAllister. Okay. You started this story with a very particular sentence that needs to be called out. We knew we would have to start with IVF. How did you know that? What was that about?
So my husband has cystic fibrosis, and 99 point something percent of males who have CF are infertile. So they don't have the vas deferens, which is what brings the sperm out of the penis. So he makes sperm, but it doesn't come out. So we did have to start with them doing an exam to be sure, but we were pretty certain that we would have to do IVF.
Now, this is where I say I know very little about CF. Even though I used to be in medical device consulting and pharmaceutical consulting for pulmonary, CF wasn't the world I was in. I worked in asthma and COPD. But so I kind of danced with some pulmonologists on CF. I had no idea the correlation or the connection with the vas deferens. So could you just share for those people that are listening right now that maybe have never heard of cystic fibrosis, could you just share a little bit about your husband's condition?
Yeah, so it's a genetic disease. So he has had it since he was born. It mostly affects like his lungs. So he does breathing treatments and takes medications for those, but then it also affects a lot of digestive issues. So he has to take medicine to help him digest food as well. And he has to eat a very specific diet, very fatty, high calorie, in order to keep his weight up and to make sure he's getting all the nutrients he can.
Where were you when you met him?
We were both volunteering through an event at our church, and we were introduced by a friend, and we said, "Hey, nice to meet you," and then didn't speak to each other for like 6 months after that.
It sounds about like most love stories.
Yeah.
How they get started. Hi, I like you, so I'm going to ignore you and be afraid to talk to you. How did the conversation go when he shared with you that he had cystic fibrosis?
So I had known he had it just because we had been friends and were in the same friend group for a while, but I really didn't know anything about it. I had done a Google search when I found out he had it, which is like his worst nightmare, that people do that before they ask him. So that's a good lesson for
Dr.
anybody.
Google.
Yeah. And so I had known just what I had Googled, but I never had asked him about it. But then when we started discussing dating and moving forward in our relationship, he had actually asked me to listen to a podcast about dating people with CF. And one of the things that they talked about in the podcast was male infertility. And so after I listened to the podcast, we sat down and had a conversation about it, which was very good to get it out in the open before we even were dating.
This is big stuff.
Yeah.
Like when some people are like talking about how do you like this or how do you like that? You're like, hey, how about we talk about our fertility journey and, genetic components of this. So what's really interesting for me to hear from you though, is that like there was sperm, just not a connection. So the harvesting of the sperm, which we'll get to, I'm assuming is a big part of your journey. Did you have, as a young adult, did you have any idea about your own fertility?
Not really. I mean, I had endometriosis and had been on birth control from the time I was really young because of like painful periods and bleeding, and they had always said like, oh, you may have trouble getting pregnant because of endometriosis, but I'd never really thought anything about fertility and IVF and IUI and all those things. Like it had never even crossed my mind as something I would ever have to possibly do.
Well, I'm going to interject right there because I interviewed a CEO on this podcast that I adored, Afton Veckery, and she's the CEO of Modern Fertility. And the whole purpose of this platform is to get women like you, but in their teens, like when you're diagnosed with endometriosis and you're going on birth control, send a couple vials of blood away and test your fertility so that you go into your 20s and 30s and sometimes even your 40s. I'm not going to dare say 50, but with your fertility and you sort of know what you're looking at. It's something I really want to empower women and birthing persons to start asking about your fertility. Don't just assume, because it's really hard when we're 24 and we're trying to have a baby for the first time, or 34 or 42. And we find out that we've had these problems the whole time and never knew about it. So you weren't sure. You knew you had endometriosis. You didn't know what your own journey was going to look like, but you knew you were going to have a fertility journey. So did you decide to start a family before or after marriage?
After.
After. Okay. So you guys get married, start a life
Mhm.
together. When did you start having the conversation about IVF?
So my husband every 3 months has to go to his CF clinic, which is in Raleigh, North Carolina,
Okay.
and he goes there and sees his provider, a social worker, a nutritionist every 3 months. They do his like lung function tests. And while we were there, I had been going with him. So this was the first time we had gone after we'd been married. We'd only been married for 3 months. And the doctor actually asked us, have you guys talked about having any kids or starting a family? Like, where do you stand on that? And we told him that we had talked about it. And he recommended we just meet with the fertility clinic to just get information and to know what the process was, what the timeline was, and all of that so that we were prepared when we were ready. So we made an appointment and we had talked before then, but we were pretty decided that we would rather start as soon as possible because we both knew we wanted kids, but also because of age. And age is a huge factor with IVF, and we just wanted to be in the best position we possibly could be in.
How old were you?
I was 28 when I did
Okay.
my egg retrieval.
Okay. How old was your husband?
He's 30.
Okay. He's 30 now, or he was 30
He was
then?
30. I'm sorry.
He was
He was
30.
30.
So 28 and 30.
Hmm.
So for most 28 and 30-year-olds, not thinking a lot about fertility and these really hard conversations and decisions,
Hmm.
right? What are the chances of, like, we're going to get into the IVF process in a second, but like, what are the chances that your embryos using your husband's sperm that's harvested would be also positive for or a carrier of CF?
So we did genetic testing beforehand to find out because if I don't know how much you know about CF, but with people with CF, they cannot be in proximity to each other. There's actually a movie that came out a couple of years ago called 6 Feet Apart about a love story between two teenagers who have CF, and they're not allowed. You can't be close to each other because people with CF have different. They're called bugs in their lungs, and if you transfer them, it can make the other person very sick. So if we were to
I
have
have
a
never
baby,
heard of this.
yeah,
The
I had
movie is
never
called
known about it.
6 Feet Apart.
Yes.
And this is like
Hmm.
before coronavirus, 6 feet
Yeah.
apart, like
Yes. Yeah.
like totally different 6 feet apart.
Yeah.
Okay, well,
Yeah.
now I know what I'm watching while I'm laying
Yeah.
around in my compression bra for the rest of the
Yeah.
day, waiting for my boobs to heal.
That's
Wow,
funny.
I'm
Yeah.
gonna ball my face off. I'm assuming.
Oh yeah. It's really good, and it's definitely like a teen movie, but it also we brought friends with us to go see it like on opening night, and it started a really good conversation with our friends about CF and what it means, and it was really really cool, and it was fun to see like CF represented in the media like that because it's
Yeah.
usually just like not the same. It's like medical TV shows and different things like that. So it was really cool. But if we had a baby who had CF, it could be potentially devastating that Wesley, or my husband Wesley, and the baby, I mean, they would be able to interact, but it would be hard. It would make things a lot more difficult. So I did genetic testing to see if I was a carrier, and I was not. So we didn't
Okay.
have to worry about that. You need two people who are a carrier, and if they're both carriers, you have a 1 in 3 chance
Okay. So the
of
fact
your
that you
baby.
are not a carrier of CF means 100%
Hmm.
scientifically, without a doubt, you were not going to have a child with CF.
Yes. Yep.
Okay. And that it would be safe for your future child and your partner to be
Hmm.
6 feet in
Yeah.
closeness and for
6
love
feet
and
together.
kisses and snuggles and hugs and affection and all of those
Yes.
things. Golly, that just sounds very stressful. I am so thankful for technology
Yeah.
with these fertility journeys. Okay.
Hmm.
So let's dig even deeper. Let's keep going.
Okay.
Okay. So you did the genetic testing
Hmm.
and you kind of alluded to the embryos and such like that. But could you just talk a little bit about the IVF process?
Sure. So it started off with, meeting with the doctor and just having a consultation to talk about plans and best course of action, all that stuff. We did the genetic testing. We only did CF testing because we wanted to have as little hand in it as possible, but there's a lot of other tests people can do, especially if they have family history of things. So it was just a decision we personally made that we just wanted to test for CF. You
Okay.
can test, for everything. So we did the CF testing, and then from there, they did a saline ultrasound, which is like a mock transfer. So they check your fallopian tubes, check your uterus, make sure there's no blockages, cysts, things like that. If there is any cysts, they'll either remove them or put you on different medications. But thankfully, everything was clear.
Were you under general anesthesia for that procedure?
No,
You were
you
awake?
take some ibuprofen before, and yeah, it feels. I personally think it felt like a pap smear. Like it didn't, but I've heard other people say that
Amazing. Pap
causes
smears
cramping.
feel amazing.
Yeah. But we
Okay.
also started this whole process. We had our last meeting before starting my injections, my stimulants, the week before COVID shut down. And so we were at our appointment, and they were like, we can't guarantee you're going to be able to start IVF next week. And then we got a call 3 days later that we were not starting. So it pushed us back a couple of months, which was so devastating in the moment. Now I'm very, very thankful for McAllister and our life, but it was very, very hard to be told you can't have a baby.
Can't try.
Yeah. And it was really hard to like wrap my head around that. And then all of the it was just very hard. So, but then after a few months, we started the process again. So Wesley had his sperm retrieval procedure. He was awake for that, but they did give him like painkillers and some medicine to make him kind of like out of it. But I had to drop him off and wait in the car because of COVID while he got that done. And then they went
all alone.
Yeah.
Oh no.
And they went in with basically a long needle and tried to pull out sperm, and then they ended up having to take a little piece of his testes to get the sperm because they couldn't get any with the needle.
It was kind of trapped in there.
Yeah. And
this
and they
now,
told us that was a possibility.
People are super confused right now. I promise
I'm sorry.
you. No, it's okay. Because like I'm a doula, I get this, right?
Yeah.
People are very confused on the fact that semen and seminal fluid or ejaculate are different things.
Yes.
And that they mix and combine. And so is there any more that you could share just to help people understand like where the sperm is located versus like the ejaculate? Is that something that you want to talk about? Like I'm tracking with you because this makes sense to me. But what we need our audience to understand is that semen and ejaculate fluid are two different things.
So the semen is I'm not sure that I know 100% medically, so correct me if I'm wrong, but it is stored in the testes.
Yep.
And there's a tube called the vas deferens that takes the semen out and it mixes with the seminal fluid, and then that comes out during ejaculation. So
bravo! It's like a medical degree, Em. You did it.
So he does not have the tube that transports the semen. So it's all just sitting there. But because of that, could be some like motility issues where it's not doesn't work as well as some other semen or sperm because it's just sitting there. So that was the issue that they faced when they tried to pull it out. It wasn't good quality enough sperm, so they had to cut a piece of his testes off to take it from that, which ended up being good quality. So it was good.
Okay, now for all of those IVF warriors out there, often you can achieve multiple children with one harvest.
Yes.
Right? So were they able to kind of get enough sperm from your husband to have multiple embryos for the future?
Yes. Yeah. So we have tubes of sperm. Okay. And we have embryos that are already made. So if we needed to do we needed to make any more embryos, we could use that. So he wouldn't have to have the procedure again.
Okay. Because that's a big part of IVF that people don't understand is that like we have to harvest eggs.
Yes.
And we have to harvest sperm to make embryos. And so a lot of times, often, especially for the female or the assigned sex at birth female birthing person, it's you have to do this multiple times, this egg harvesting, and often
Yes.
for the sperm also. So you guys were able to get a couple vials of sperm so that you could do
Yes.
this more than one
Yeah.
time. How about on your side? How many eggs were they able to retrieve in your egg retrieval?
So we had about 16 eggs retrieved.
That's a
And then
lot, girl.
yeah, and then we
Jeez.
had 4 make it to embryo. So once
Okay.
they were fertilized, we had 4. So we still have 3 frozen.
That's a high success rate.
Yeah.
Okay.
Yeah, it's great.
Every now and then I'll hear a story of like where somebody gets 8 or 10 and you're like, whoa. And then most of the stories that I hear, especially as a birth doula for many clients on fertility journeys, is that there's just one
Yeah.
or none.
Yeah. Yeah.
So 4.
Yeah.
How many children would you like to have?
I we go back and before I ever had a baby, I was like, I want like 10 kids. And now that I've had one, I'm like, I don't know if we're gonna do it again. So that's
It's
we're
funny
just
how it changes things, isn't it?
yes.
You
Yeah.
lose one night of sleep and you're like,
Yeah.
done. Fuck it. No. Shoot. I don't know if I'm allowed to cuss on Fireside. Well, maybe I
We'll
just
find
won't
out,
say
I
any
guess.
more cuss words from here on out and they'll let me know if that is, shoot, I have to censor myself. I don't want to get in trouble on my first
Yeah.
episode. Okay. Anyway, if y'all heard that, I'm so sorry.
Yeah.
We'll pretend I didn't do that. And I'm going to make this PG for the rest of the
Yeah.
time. That was under general anesthesia, though. However, I do know that your egg retrieval.
Yes, my egg retrieval was under anesthesia. And
Okay.
again, because of COVID, he dropped me off, waited in the car, picked me up afterwards. And same for the transfer.
So
When they
romantic.
put I know, I was like, you're not even in the room with me as they're putting our baby inside of me. It's kind of
No.
crazy.
Hopefully, you guys went home and had sex. Did
We went home
something,
and
at
went to
least
bed.
kissed or something. I don't know, ate chocolate, did something in the realm of romance. I don't know to memorialize the moment. So you had 4. You
Yes.
transferred just 1.
Yes.
Okay,
Mhm.
because some people will transfer 2, go for twins.
Yes. So
See what
our clinic
happens.
only recommends 1 unless you have history of depends on age and then history of failed transfers. They might let you do 2.
Okay.
But based on my age and it being our first time, they wouldn't have allowed us to do more than 1.
Okay. I'll be honest. Mine are 15 months apart, And
Mhm.
I was, I'm in my 40s with a kindergartner. So
Yeah.
I was much older parent going into this, much older than you going into this. And if they would have said 2, I would have been like, yeah, done. 2 and
Mhm.
1, but only 1 pregnancy. Just get through the hard 2 years, move
Yeah.
on with my life,
Mhm.
But I see like that would be a hard decision. Things you have to think through that the
Yeah.
average person at the grocery store might not be thinking about in their accidental pregnancy,
Mhm.
So
Yeah.
pretty frustrating. So these 3 remaining embryos are frozen,
They are.
and then
Yep.
you can decide what you want to do with your
Yes.
family later.
Yep.
Okay.
And we just have to pay rent for the sperm and the embryos until we decide.
I swear to you, this is the type of business I'm going into
Yeah.
next. I am going to buy a facility that stores things.
Mhm.
That's where the money is. I'm
Yeah.
telling you, storing eggs and sperm, cord blood,
Mhm.
cord like the tissue, the placental tissue. This is like money makers. I
Yeah.
think this app is partly owned and run by Mark Cuban. And I'm like, hey, hint, hint, buddy, there is big money in fertility
Invest.
and
Yeah.
in storage of
Mhm.
things like placenta tissue, cord blood, sperm and eggs. It's kind of like ham and eggs, but sperm and eggs. I don't
Yeah.
know. Okay. So you do this transfer.
Mhm.
It's successful the first time.
Yes. Yeah.
Congratulations.
Thank you. It was incredible.
Now,
We're
the
very
medicines
lucky.
make you think you're pregnant, even if you don't know if you're pregnant. So, if
Yeah.
you were, from what I understand from my clients with IVF, if you were to pee on a stick the next day, it would tell you that you're pregnant.
Yeah. Yeah.
So,
They don't recommend taking a test at home at all, because you can have a false positive, you can have a false negative, and it can show up positive, but really it's a chemical pregnancy. So they tell you not to do it at home, but I don't know many people that don't do it at
Yeah.
home.
But I'm assuming that when they do the transfer, you get to see an embryo inside your uterus. That
Yeah.
feels pregnant to me.
Yes. Yeah. And you're seeing like they're doing an ultrasound at the same time. So you're watching it go in, and it is incredible to
That
see.
is really incredible.
Yeah.
So the definition though now for cases of IVF are we have an embryo that then implants to the uterine lining and begins
Hmm.
to grow with a fetal
Yes.
pole and all of those things. So
Hmm.
how soon after an embryo, sperm and egg connected, are inside your uterus, how long is it until you bleed it out or you know you're pregnant? How long is that
So
process?
I went back 9 days later
Okay.
for a blood test. And then they
Okay.
have you come back 2 days after that for another blood test to be sure your HCG levels are rising.
And yours were?
Yes, yeah. And
Did
I did
you?
do a home test even though I wasn't supposed
Oh,
to.
you're such a bad student, Em. Oh my goodness. So did you feel, I know that sounds like a weird question, but did you feel pregnant? Is that a thing?
I def I definitely felt odd, but I also like all the medications you're taking. I mean, I was doing weeks and weeks of shots in my stomach and shots in my butt, and like I felt so not normal the whole time. So it was hard to be like, oh, this is because I'm pregnant, or is it because I have all these hormones getting injected into my body?
I feel like this is a really good moment where I want you to speak to all of the persons out there with CF that are worried that no one is going to do that for them. No one is going to love them or no one is going to
Make me
want
cry.
them. I know, but I think it's really important to share that message right now, what you did and were willing to do for love, so that
Yeah,
it gives other persons with CF hope that someone will love them and this will not be a big deal.
yeah, because love is about more than CF. It's about more than what you have to do to have a family. Like I wanted to do this with my husband because we love each other so much. And he would say, "I'm so sorry you have to go through this, but it wasn't I never thought I'm doing this because of Wesley, because of his cystic fibrosis. I'm doing this because we're starting a family together." And I would do way harder things to
Yeah.
to do that for him and to do it for us.
Yeah. I know that's a little teary. It makes me cry too,
Yeah.
but it's really important that the persons in this world that are the least amount, right? And they
Yeah.
feel they're alone, that they're not alone and
Hmm.
that you're lovable no matter what your story is,
Yeah.
right?
Yeah,
And
and
that
there's
if it's
everyone has a story. It doesn't matter if it's I mean, it could be anything, and that's what I we talk about this all the time too. Like his story is his story. It's not like it's so much worse than anybody else's. We all have something that we've had to overcome or go through. So,
yep, every single one of us. My birth story audience knows my story, you know. I was
mhm.
very, very in love with my husband who let me know they were a transgender woman 6 years into our marriage. And you do what you do for love to make sure that
Mhm.
your family is okay and
Yeah.
safe. And that, like, I think that's a message I want to leave today too, is that, you know, we are all deserving of love.
Yeah.
And there are lots and lots of people ready to love you. So,
Mhm.
you know, get on that dating train, no matter what your
Yeah.
story is. Get out there. Okay. So tell me, how did your pregnancy go?
Um, so it started off a little bit rough. I had SCH, a subchorionic, I can never say it right, hematoma.
Subchorionic hematoma.
And so I bled pretty heavily from about 8 weeks until 20 weeks. And that
Okay.
was really hard. Um, Once I hit 12 weeks, they were pretty confident that everything was going to be okay. But before that, they always told me at every ultrasound, we can't guarantee that this won't result in a miscarriage because I was bleeding so heavily and had huge blood clots. But
Did you have a
I
blood
mean,
transfusion?
no, I didn't.
Okay. Low iron?
I do have, I did get low iron during pregnancy, and I have since been diagnosed with anemia that I didn't
Okay.
have before
Yeah,
pregnancy.
the ferritin stores get very low when we're bleeding that
Yes.
much. Okay, this is where I just need to pause for a minute and make sure our audience knows what in the heck we're talking about. Okay, so a subchorionic hematoma in pregnancy is where blood can pool between the uterus and the placenta, and it can cause these big, giant clots, essentially. And it usually resolves by 20 weeks. So exactly when yours resolved. Sometimes it doesn't resolve. Sometimes it does result in loss or miscarriage. Sometimes it results in accepted termination in order to save the mom's life because she's losing too much blood. And she has to choose between continuing to lose too much blood and the baby that's inside of her. So it can be a really difficult and challenging diagnosis and super scary and also just not fun to bleed every day, right?
Yeah.
So, I mean, you're talking 8 weeks, is what you said, 8 weeks solid of like every day wondering, I wonder if this is a miscarriage or if this is a whole bunch of blood from a subchorionic hematoma.
Yeah. 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 And it was,
I'm sorry.
it's okay. It was messed with my mind a lot because it would be like, oh, this has to be it. There's no way this isn't a miscarriage. And then I'd go for an ultrasound the next day and they'd be like, no. And not that I wanted that, but it was just like, oh my gosh, how am I going to know when when it is a miscarriage or when it's not? It was very hard.
I think any normal human being would have those feelings.
Yeah.
Absolutely. So at 20 weeks, did it just kind of slowly dissipate and go away?
Yeah, I mean, I would have spotting a couple of times and then it just completely stopped and I never had any other bleeding for the
Oh
rest
my
of the
gosh, that
pregnancy.
makes me so happy for you, Em.
Yeah.
So 20 weeks to 40 weeks. This is the fun stuff.
Yeah.
This is typically when like the nausea subsides, you start feeling movement in your belly, your starts to grow and people know you're pregnant.
Yeah.
Talk to me about weeks 20 for 40. And I want to hear, like, did you start thinking about what type of birth you wanted to have and where you wanted to have it?
So I always knew I always wanted like a home birth or a birth center. I definitely wanted a midwife and a doula. My background is in health education, so I've taught a lot of like women's health education classes, and actually have traveled to Haiti and taught like family planning classes, and so I'm very like pro women's like rights and choice and like what or any other birthing person's rights and choices and what they want for themselves. And I always knew that's what I wanted, but I was very worried that because I did IVF, I would be not considered a low or not a high risk pregnancy. But thankfully, the birth center I went to, while some do consider IVF high risk, they don't. So I was able to do a birth center birth, which I was very excited about. We actually hired our doula, I think, before I even had my confirmation ultrasound with the IVF clinic because I was so
How did you
excited
find her?
Actually, I don't think you probably remember this. I actually reached out to you to be my doula, and
Ooh,
you,
yay. I don't
yeah,
remember that. I'm sorry.
yeah, it's okay. No, no, no. I know you're busy. And you didn't service our area, and I think that was before you and Colin started like your team together.
Yeah.
But you gave me Colin's information, and that's how we got connected. So
That makes me feel amazing, you guys. I referred Em to her doula and I didn't even know it.
Yeah.
Yay. Okay, so Colin was your doula.
Yes.
Okay, the Birth Story podcast listeners know Colin is my girl. She's my jam. She took a 40-something-year-old who had to wake up in the middle of the night at 2 a.m. And I came to her and was like, I can't do this, dude. I have this company called Birth Story Media, and then I have doula clients, and I can't keep working at 2 a.m. So Colin works the night shift for me, and I work the day shift for her. It's amazing. So at this point, you were Colin's individual client because now our clients are together. Oh, this is really exciting. This is a fun little flip of the script for me.
Yeah.
So you are going to be the birth center closest is about an hour outside of Charlotte, North Carolina. Is that where you were at Natural Beginnings?
Yes. Yep.
Okay. Not sure if I was supposed to say the name of that place. I usually just say birth center, but Whatever.
Yeah.
Everyone can figure that out.
That's okay.
Let's just not say any providers' names.
Perfect.
Okay. Because since we're live,
Yeah.
I'm like, since we're live on here, let's just scratch the providers' names.
Yeah.
So you have a doula. You're
Mhm.
going to be birthing at a birth center. Do you live kind of closer to that area then?
We're 50 minutes
Okay.
from the birth center. Yeah.
Yeah. So am I. That's why I don't take births. Take births there. One every now in a blue moon, but usually why I don't. So, okay. So you were like, okay, you knew in the middle of your birthing time or labor, I'm going to have to drive an hour to go.
Yeah.
Why not a home birth?
So we had talked about it with Colin, talked about it with my husband. He is I think because of having cystic fibrosis and like being raised in like such a highly medical way, like having to like go to doctors, go to hospitals, do all these medications, he is very like confident in the hospital system, and which is great, but it's not what I wanted. And so we compromised on I wanted a home birth and he felt more comfortable with hospital, so we compromised with the birth center.
Okay.
But I'm very
I got
thankful
it.
for that decision.
I got it.
I think it was the right choice for sure.
Yeah. Okay. Well, let's fast forward then. I'm going to ask you the most important question of the whole Birth Story podcast. The reason people show up here. How did you know you were in labor?
My water broke.
So it was obvious.
Yeah, it was.
So first sign, water broke? Like you weren't even having any contractions?
No contractions.
How far along were you in your pregnancy?
I was exactly 37 weeks, which was important because you can't have a birth center birth. So my water broke actually the night before I was 37 weeks.
You are so lucky.
I know.
Everyone listening, full gestational term. And when we are IVF clients, we know exactly that guess date is pretty accurate versus if you conceive spontaneously, your sperm lives 6 days, right? It has 6 long days inside your uterus to figure out if there's an egg there and try to penetrate it. So like a guess date to me is really wonky and means that word I can't say on a live show, but like doesn't really have much weight or mean anything unless you're IVF. Okay. Then you got a pretty clear window. 37 weeks is full term. Otherwise we don't qualify. It's a considered preterm labor if you're 36 weeks, 6 days or before. And in our area, that would require going to a hospital. For what you experienced was considered PPROM. So you were 36 and 6, which is preterm, premature rupture of the membranes. Okay. So you people might have just said prom, but if you were 36 and 6, you're actually PPROM, preterm. Okay. So your water breaks and you're like, whoa.
Yeah.
Wasn't expecting that.
I didn't know because it wasn't, Colin had told me this multiple times that like when your water breaks, it's not necessarily going to be like in the middle of a store and this like huge gush. Like it's not like in the movies. And I thought I just peed my pants. And then I stood up and was like going to the bathroom and I was like, I can't still possibly be peeing. Like there's no way this is still pee coming out of me. And that's when I figured it was my water not going to the bathroom.
Colin is such a good doula. Yeah. Mainstream media. It is not always, sometimes it is a big pop and a gush.
Yeah.
In fact, I was at a birth last week, the night before I went into my surgery. And her name's, I'm going to do initial D. Her first initial is D, and she's hysterical. And she's just like laying there and we're giggling about life or whatever. And all of a sudden she screams. She was comfortable with an epidural, I might say too. So she's comfortable with her epidural and we're chatting. And all of a sudden she screams like the loudest scream. And I'm like, people come rushing in. We're like, what's going on here? And she's like, my water just broke. And we're like, okay, now that was one of those movie moments, right? But the rest of the world, it feels like you pee your pants and the pee just keeps coming. So that was more your story.
Yeah.
Okay. So did you call, what time of day was this?
This was about 9:30, 10 o'clock at night.
Okay. Like always.
And so
it's always.
Yeah.
Which is why being a doula is such a hard job, but
Yeah.
amazing. Like right as we're about to go to sleep, here's Colin about to go to sleep that night. And then here's Em like ready to go to work,
Yeah.
you know.
Exactly.
So because you were P-prom, but just by a couple hours,
Yeah.
we could have fudged that a little bit, but we're just a
Yeah.
couple hours for P-prom. What was Colin your first phone call or did you call the birth
Yeah.
center first?
So no, I called Colin first because I still was not 100% convinced that's what it was, and because wasn't having any contractions. Um, and so I did call her, and I don't think she was convinced it was my water at first, and she said, "Just put on a pad, like lay down, see what happens." And then I called her back like an hour later, and I was like, "I've had to change my underwear 4 times." And she was like, "Okay, it was your water." And so
Definitely.
yeah, and then I called the birth center and told them.
Okay. So what was the plan? Because I mean, as a doula,
Yeah,
I can walk you through in my head what I think we
yeah.
would do. But tell me about what you and your doula and your birth team decided to do for your birth at that
So
point. Stay home, go
yeah.
in. What'd you do?
So I just stayed at home. That was the
Okay.
plan. Stay at home, wait for contractions to basically start.
Mhm.
When they started to start, if like start monitoring, I guess, not like sitting there timing every single one, but just like keeping an eye on things. And then in the morning, I was gonna call back the birth center,
Okay.
and that was the plan for the night, and to go to sleep. That was the
Okay.
plan.
I'm
Yeah.
so excited. Let me just pause here, you guys. Did you hear him in a birth center or a home birth? Like everyone's chill. Your water breaking does not mean like, let's race to the hospital.
Yeah.
Like there's such a myth, right?
Hmm.
Data suggests that when your water breaks like this, like it did with M, preterm, premature rupture of the membranes, or just premature rupture, meaning your first sign of labor is your water breaking. Data shows that within 6 to 8 hours, you should start having cramping and contractions.
Hmm.
You should still deliver within 24 to 36 hours, usually. Okay. But like, we don't really expect anything to happen low and slow for 6, 8, 12, 24 hours, your body to get the message that the water is slowly leaking out in a series of signals. God only knows what the mechanism of action of labor is. That's in the $1 million question. If there's any OBGYN could figure that out, we would be zillionaires. I'll invest. But like, since we don't know the mechanism of action, there's a series of events that's happening as that water's trickling. So I'm so thankful they told you that, Em, because I want
Yeah.
everyone to hear that. Go to sleep. 10 o'clock at
Hmm.
night, go to bed, go to sleep. What happened? So that's what they told you to do, but
Yeah.
then what
I did
happened?
not sleep. I put on Parks and Rec and sat in bed and watched Parks and Rec while my husband slept next to me. I think I was just well, I was obviously I was just so anxious for what was to come, and I was so like in my brain, I was like, "This, I'm not ready. I was not prepared for this. I have a whole list of things I have to do." But also just like, when is it going to start? What am I going to do next? And so I just could not shut my brain off to go to sleep. I wish I had. I very much
Okay.
wish I had gone to sleep, but I did not.
Did you call Colin for any advice or tips,
Yeah.
or did you?
Yeah, I did call, we called her a couple of times. I didn't want to, just because I knew I wasn't like that nothing was happening. I was trying to let her get her sleep. But I did take like a bath, laid in the bath and relaxed, and then um did some different like stretches and different things to try to, just calm down and relax. But she just kept saying, "Go to bed. Close your eyes and go to bed."
Yes.
um yeah. But the my contractions didn't start I didn't start having like cramping contractions and still until like 4 or 5 in the morning, and they definitely were not consistent by any means.
Yeah, but look at that. That was exactly
Yeah.
like 6 to 8 hours later,
Yeah,
what data says.
exactly. Yeah.
So your textbook
Yeah.
right there.
And
Okay, so they
and
started
then
coming early in the morning?
yeah. And then the birth center actually called me in the morning, and because I had just had my 37-week appointment and they did my GBS test, the results had not come back yet. So they contacted me to see if I wanted to do antibiotics or not because I didn't have the results, and that was up to me. And so they ended up because I wanted to. We ended up going into the birth center, so they could start antibiotics, and see how far along I was.
Okay, now I'm going to fast forward. When the
Yeah,
results came back, were you positive or negative?
negative.
That's all right. I was just wondering.
Yeah,
You're usually negative. It's really more
yeah,
rare to be positive, but you
yeah,
were practicing proactive care
yes,
rather than reactive care with the
hmm
information that you had. So
yeah,
that's something, a choice that you made for your body. So that's
yeah,
good. But that means getting to the birth center and getting antibiotics started if you are group beta strep positive.
hmm
Everybody can go research that on evidence based
yeah.
birth. I love that website. Evidence based birth, all about group beta strep. So when you got to the birth center, tell us what it's like. What does it feel like?
So I got to the birth center, and the midwife meets you out in the parking lot, which is really nice. Walks you in. So we went into just an exam room, so she could check how far along I was. Um, and in order to basically start being at the birth center, um, you have to be progressing in your labor. And I was only 2 centimeters, and my contractions were still not consistent. So I was given the option to wait basically in the exam room or to go home and to be at home and see how things progressed. So even though it was a
Only one
50
of those
minute
sounds
drive,
like a great option.
yeah. Yeah, so even though it was 50 minutes, we turned back around and went home.
Did
Um,
they administer antibiotics though while
they
you were
did.
there?
Yes.
Okay.
Yep, and
Okay.
she did I can't remember what it's called, a test to like around my
Non-stress
stomach.
test?
Yes. Yep.
Yeah. Non-stress
Um,
test just to check on your baby's fetal movements and that type of thing, heartbeat.
yes.
Yeah.
So we got back home. I was given the midwife's brew to take, because
Yeah.
I wasn't really progressing, and because, like you said, you want to wait, or you can wait, but you don't want to wait too long. So because I was only 2 centimeters, they gave me that,
So
and
they
then
just gave
probably
you the
like
recipe for the
the
midwives
recipe.
brew.
Yes.
Okay.
Yep. So we stopped on
So
the way home and got things.
if anyone right now is like, what in the world is the midwives brew? Okay. It is in lots of the show notes on many episodes of the Birth Story podcast. But essentially, it's 2 ounces of castor oil
Hmm.
mixed with lots of different things. So, champagne, nectar, almond butter. Okay. That's the recipe I love. What did you
Hmm.
mix it with, Em?
Same thing.
Same
Just
thing.
exactly what
Okay.
I used. Yeah.
Yeah. Okay. I was like, I think I probably got the recipe directly
Yeah.
from those
Yeah.
midwives. But that's a really good thing to do if it's a natural induction method. If you are not a VBAC, and like if your provider is telling you to go
Yeah.
home and drink castor oil, why not?
Hmm.
So I don't know how Fireside chat works if I get show notes yet, since this is my first episode. But if I get show notes, I will go ahead and re-put the midwives brew in the show notes. Um, how did it taste? And like
At
what was it
first, I
like
was
to
like,
drink castor oil?
this is amazing. But I think it was, this sounds so silly, because of the champagne and the like bubbles. I was like, oh my gosh,
Oh
I haven't
yeah.
had wine or champagne in 10 months, and tastes delicious. And then after like 3 sips, I was like, I'm not doing this anymore.
Yeah.
Like I
It's
just
like
did not.
totally like an addict breaking their sobriety,
Yeah.
the first sip, you're like, yes. I don't know because I'm not sober, but I'm just
Yeah.
guessing.
Yeah. Um,
Amazing.
but it's like thick, and I can't say that I enjoyed it.
Mm-mm.
But
Nope.
within like 30 or so minutes of being home, my contractions started getting super intense and pretty consistent. And so then we called Colin,
Okay.
and that's when we turned back around and went back to the birth center.
Okay. So you felt like you were moving into active labor
Yeah,
versus your early
yeah.
phases of labor. What
Mhm.
time was that?
That was around 12:30. I think
Okay.
that's about what time we got back.
Okay.
to the
So
birth
about
center.
14 hours after your water ruptured, you were
Hmm.
having consistent, strong contractions
Hmm.
where it was time to call your doula.
Yeah.
That's
Yep.
really important, right? First time birthing persons are often confused on how long their labor is going to last and like when
Hmm.
do they call for help. So it
Hmm.
sounds like you called for help when contractions got kind of strong,
Yeah.
and close
Yeah.
together.
Yeah.
So
It was like
what
once I
did you do?
couldn't.
Oh, I'm sorry.
No, it's
See, I
okay.
can't
I was
even
saying like what.
interrupt on a live show.
Yeah.
You first.
I was just saying once I like couldn't talk or couldn't like I felt more like I was like couldn't handle them as well. That's when we were like, okay, maybe we should call Colin and head to the
Okay.
birth center.
So 50-minute drive back.
Yep. It was a little bit worse of a
Now,
drive than the first drive.
can imagine. What did you do for comfort? Were you like in a sitting down in a seatbelt or were you like hands and knees, legs up? What were you doing?
I was sitting in the front seat, but I was curled up and I was like holding on to the handlebar. And I
Yes.
just sat there with my eyes closed the whole drive.
Oh gosh. Okay.
Yeah.
And then you made it home.
Yeah.
Do you know, it's like we only live in the moment, right?
Yeah.
I remember driving to the hospital, but I'm like, yes, not yesterday. I'm 6 days post-op. The drive home from the hospital after having my breasts reduced,
Hmm.
every, I felt every pebble
Yeah.
on the street. I was like, someone needs to pay the city to pave their things. Like when you're having a contraction and you're in the car and there's
Hmm.
any bump or jiggle,
Yeah.
it exacerbates it by like 1,000.
Hmm. And all
So
the bad drivers. I was like, don't these people know I'm in labor? Like, I need to get out of the way.
flashers on, like
Yeah.
horn, get out of my way.
Yeah.
Okay. So you get back to the birth center, and at this time, are they like, we accept you, Em, you're
Yes.
far enough along?
Yeah.
Okay.
So they brought me, I was the only one there at the time in labor. So that I got my choice of room. So there was 3 rooms I could choose from. So I got to go into the room and basically just got comfortable. Um, Colin wasn't there yet, so they checked me again. And then our midwife put on some essential oils, showed us how to like plug in our music, and then she just left. Gave us a little button to press if we needed something, and then just kind of left us to ourselves, which was
To be.
comfortable for me. I was much happier to just be with my
You knew
husband
you were going to
versus,
give birth there.
yeah.
You had already arrived. And so it's
Hmm.
okay. Just be alone.
Yeah.
Yeah. I want to say something about those vaginal exams because I'm not a
Yeah.
big fan of them. And my
Hmm.
listeners know this. Okay. But the birth center operates under specific laws and guidelines. So, in order to birth at a birth center, they have to check your cervix every 4 hours in order to keep you there. So, in our state in North Carolina, if they were to check your cervix and you weren't making progress, whether the cervix be softer, come more like position from posterior to anterior mid center. So kind of the cervix move forward, be softer, the head be lower, more cervical dilation. Like there's lots of different things that indicate progress.
Hmm.
But that kind of tripped me up a couple of times when I was at birth centers. At hospitals, you can refuse vaginal exams. At a birth center, to my understanding, you guys can write in if I'm totally wrong, but at the birth centers in my area, we're not able to refuse vaginal exams, even if your water's ruptured because of these laws and guidelines to even be able to birth at a birth center. So I wanted to make
Hmm.
sure that I said that. Like, if you're at a hospital and your water's broken, please don't get your cervix
Yeah.
checked. But if they make you, okay, well, they make you so you can have
Yeah.
a birth center birth. So,
Hmm.
so talk to me about like where were you? How far along were you?
At that point, I was still only 3 centimeters. Um,
You girl, give yourself some credit. That is a lot.
yeah.
3 centimeters. You were at 2. That's giant
Yeah.
progress.
Yeah.
Yeah.
So I was 3 centimeters. I don't remember now. I have it all written down somewhere, like how close contractions were. and things like that. But 3 centimeters, but I was very uncomfortable.
Okay. So for
I
persons listening that are arriving at their place of birth and they're 3 centimeters and you are uncomfortable, what helped you? Because there's no epidural at a birth
Yeah,
center.
no.
So,
I biggest thing was just like positional changes, like not being in one spot for too long. There was nothing that was like the most comfortable, but it was like, okay, I'd lay on the bed on my side for a little bit, and then I'd get up and sit on the ball for a little bit, and then I'd get up and sit on the toilet for a little bit or go in the shower. And just the movement for me, and knowing that I could go and get up and pace or do whatever was very helpful for me. So like as soon as I started to get a little too uncomfortable, I would just move somewhere else, and that helped me.
okay. What about water?
Like
Did
a
you
water
birth
birth.
in the tub?
So
I just know that
I
there's big tubs there. Sorry.
yeah, no, that's fine. It's funny because I feel like when people think like, oh, birth center, home birth, it's like assumed you'll labor in the tub or you'll give birth in the tub. And I remember before even my water breaking and stuff, people would ask me, oh, are you gonna have a water birth? And I was like, I don't know. Like we'll see. I have no idea because I've never given birth before. And so I think by the time they they didn't check me again, because from that point it just started moving really quickly. Um, or if they did, it was one more time. And by the time they put the tub up and started filling it with water, I was already like about to start pushing. And so I got in the tub and I didn't like it.
Okay.
And I think that if maybe I had gone in it earlier and had like a chance to relax, but at that point my body was already like pushing on its own, and I started to panic because I couldn't get comfortable to like sit in the tub in the right way. Um, and so once I was in the tub, they checked the baby's heart rate. And I think because I was starting to panic a little bit, the baby's heart rate dropped. And so if the baby's heart rate drops, they have you get out of the tub. So, which was fine with me because I didn't enjoy it.
Yeah.
um, but I got out of the tub and I wanted to lay on the bed, and I laid on the bed, and it was like 7 minutes later, our baby was born. So it was very quick.
Wow.
Yeah.
So you experienced the fetal ejection reflex.
hmm
Can you explain to the audience, like, what was that like? What did that feel like?
So I had heard the term and I knew it was a thing before, but I obviously didn't have never experienced it, didn't understand it. And I was having a contraction. I was laying in the bed and I was kind of like in and out of not consciousness, but in and out of focusing and being aware of what was going on. And all of a sudden, my body just like bore down without me doing anything. And I just was like making these grunting sounds, but I wasn't purposely trying to push. And I didn't think anything of it. Like my husband said that he panicked. Like he was like, "There's something wrong with her. This isn't normal." And in my mind, I was just like, "Okay, this is the next stage of what's happening, but I don't know what it is." And yeah, it's just so. It was such an insane feeling to know your body is completely in control without you telling it what to do or what. It, it was a bizarre feeling, but a really cool feeling too.
Very cool. Now,
Yeah.
most people that I work with, that have an unmedicated birth, I'm not going to give it away. I'm just curious. Would you describe it as childbirth as painful?
I The contractions were painful. Actually giving birth was not painful.
Okay.
Is what I would say.
So
I
interesting.
loved giving birth. Like I would as soon as it was over, I was like I would do that over and over and over again. Like I loved giving birth.
Very cool. Well, it sounds like you had if I could break it down, you had a great
Yeah.
team. You had
Yes.
the right birthing location. You
hmm
had patience. Like, it's not like race to the hospital and put Pitocin in your IV, right? Like, it's just like take a nap, chill, eat something, come back in 14 hours when you're having contractions, right? Like, and then you were able to have free movement of your body to find what was
hmm
comfortable for you and make autonomous choices. You know, the one thing
hmm
we didn't hear from you was, except for your husband panicking when you were
Yeah.
making noises, What role was he playing? What role was Wesley playing? And how did he support you when you look back? What helped that he did?
He literally didn't leave my side the whole time. Was just hand, and we're both physical touch people, so he like had his hand on my back, had his hand on my face, had his hand on my arm, constantly touching me. Not even necessarily like saying anything, but just knowing he was there for me and the way our relationship is and the way we love each other. It was like the most perfect thing he could have done. Um, he and he will admit this too. Like the counter pressure, things like that, he had no idea. He tried and I was like, "You're not strong enough. You're not doing it good enough." But I just needed to know he was there, and he did not leave my side or stop touching me the whole time, and for me that was what I needed. So,
Yeah. Did you talk about that in advance, or is that just something that you knew about each other from being partnered for so long?
we never really talked about it, about what his role would be besides like cutting the umbilical cord. We never, but he even laid in bed next to me as she came out, which was just like so cool that he was like
Oh,
curled up next to me. It was just incredible.
oxytocin
Yeah.
flowing. Oh my
Hmm.
gosh. Amazing.
Yeah.
Were you interested in breastfeeding or chest feeding?
So we did try to latch at the birth center. I did want to. I was pretty convinced in my brain that that was exactly what we were going to do. But she was really small. She was 5 pounds 4 ounces,
Okay.
and they were a little bit concerned about weight, blood sugar levels, things like that. And so we tried. She never latched at the birth center. We went home 4 hours after she was born, and she never latched at home. And we went and saw a lactation consultant the next day and tried. Then I did pumping. We tried for a couple of weeks, but in the end, it was just way better for both of us to stop trying that and to switch over
Yeah.
to formula. It was
Yes.
mentally
Did
very
she take
hard.
the bottle? Was she able to
Yeah,
take a bottle?
yeah,
Amazing. Yeah.
yeah,
I asked this question because it's really important that we share all of our stories and all of our journeys. Like
yeah,
feeding our babies is important. How we feed them is less important,
yeah,
right? But taking care, making sure our babies are fed and that our minds and our bodies as the birthing person are taken care of too is really
yeah,
important. So thank you for sharing that part of your
yeah.
story. Um, then the last question, I have two more questions. One is about your
Okay,
placenta. Did you do
okay.
anything with your placenta?
Yeah, we had it encapsulated.
Okay. So there's a guide to encapsulation, you guys, at birthstory.com. Since especially I'm recording live and people may listen to this, like we don't eat a raw placenta. That's not a thing. Okay. It's like dehydrated, right? It's
Yeah,
very it's very Ruth Chris Steakhouse, really. I mean, it's not like so primal,
yeah,
but you did encapsulate it, put
yeah,
it into pills like little vitamins and take
hmm,
it.
yeah.
Excellent. And then for everyone out there, we always end on what is your favorite baby or mommy product that you absolutely love? So if someone's brand new pregnant and they're like
Hmm.
making their registry, what's the one thing or the two things that you would say, don't miss out on this?
We got the Duna car seat stroller when our daughter was a couple months old, and that has been a game changer in traveling because it just folds up from stroller to car seat. And we travel a lot, so she's flown like 7 times, and she's 10 months old, and so we it's been super convenient. The other thing is a nail file instead of nail clippers
Yeah.
because I cut her
I
nails
just
the first time I tried, and it was a little bit traumatic.
was that the first time you saw her blood?
Yes. Yeah, and and we went to the chiropractor the next day, and my mom was like, "No one's gonna notice." And the first thing the chiropractor said was, "Oh, did you accidentally cut her finger?" I was like, oh my gosh! So
I don't think we ever forget the first time that we see our children's blood, especially when it's our fault,
yeah,
you know? Oh, well, Em, it's been such a pleasure to have you on the Birth Story podcast and to be my very first guest live on Fireside. This is really exciting. Before we go, is there anything else that we forgot to say or that you want to make sure you share with the audience?
I don't think so. I just thank you so much for having me. This was really fun to talk about, and yeah, enjoyed it.
Yeah. Well, I really appreciate you putting a spotlight on the CF community and on the birth center community, and especially on parents who are having struggles with their feeding journeys too. We learned an awful lot from you today, and it was really special to have you be my first guest on this platform. I'm so thankful. And I would just like to say, you're welcome for everyone who's watching live for having the opportunity to see me in my nightgown in my closet recovering from my mommy makeover. You know, can't can't always be this perfect.
Yeah.
Emilee, I love it. I hope that you will reach out to Colin and I if you become pregnant again in the future with one of those other 3 embryos that are waiting for you. I would love to be your doula alongside Colin too. So hopefully we'll see you in the future.
Yeah, definitely.
All right. That concludes
Okay,
this. Thanks for Mark, Waitbot, Heidi, and Emilee for joining this live audience. I'm assuming that's Mark Cuban. I have no idea. So I have no idea how to stop this. So let's play around for a minute. And it says turn off video. Okay, let me turn this off first. And then it says leave the stage. So hold on. I hope I'm going to leave the stage, and I'm going to see you later. Okay.
bye. Thank you.
Bye,